Hi, my name is Vanessa. I'm a respiratory care student from Malcolm X College, and I'm here to talk to you about indications of mechanical ventilation. So, mechanical ventilation is indicated when a patient cannot maintain spontaneous ventilation to provide adequate oxygenation and the removal of carbon dioxide. Indications are as followed. Apnea. So, apnea means that the patient is not spontaneously breathing. An example would be a patient that is experiencing a drug overdose of an opioid drug such as morphine or heroin. And this drug, it depresses the patient's central nervous system, which leads to the depression of the respiratory drive. Then we have acute ventilatory failure hypercapnic, which is defined as a sudden increase in a PaCO2 to greater than 50 millimeters of mercury, with a pH less than 7.3, concluding a respiratory acidosis. An example, as I previously mentioned, an apneic patient with the central nervous system would fall into this category, and an ARDS patient. Third, acute ventilatory failure hypoxemic. When hypoxemia is severe, mechanical ventilation may be necessary to support oxygenation. An example would be a patient with carbon monoxide poisoning, an ARDS patient, or a patient with pulmonary edema. Then we have impending acute ventilatory failure, which means that the patient is heading into ventilatory failure based on the symptoms. For instance, a patient's blood gases being within normal limits, but a significant increase in work of breathing, which won't last for very long because it will cause the patient's ventilatory muscles to fatigue, leading to an increase in a PaCO2 and decreasing the pH levels. An example would be a patient with a respiratory drive greater than 30 breaths per minute, they have labored or irregular breathing patterns, and arterial blood gas will reveal an increase of over 50 millimeters of mercury, and their vital signs would include an increase in heart rate and blood pressure. Lastly, we have a prophylactic ventilatory support indication. Prophylactic means intended to prevent disease. This means clinical conditions where pulmonary complications, ventilatory or oxygenation failure are high. And by doing this, it is reducing the patient's work of breathing, promoting patient's recovery. An example would be a patient undergoing post-anesthesia recovery and a patient with a neuromuscular disease such as Guillain-Barré syndrome. Thank you. Have a good night.